On behalf of the Patient Safety Authority, I would like to welcome you to this webinar titled Long-Term Care Emergency Preparedness Educational Series, Introduction to Emergency Preparedness. My name is Christine Bingman, and I will be your moderator for the program. Now, I would like to introduce our speaker for the webinar. Joanne Atkins is a registered nurse and senior infection preventionist for the Patient Safety Authority. Ms. Atkins is board certified in infection prevention and epidemiology and is a fellow of the Association for Professionals in Infection Control and Epidemiology, also known as FAPIC. Ms. Atkins is a 2019 recipient of APIC's Heroes of Infection Prevention Award for Education. She is a member of the Association for Professionals in Infection Control and Prevention and has served on the Member Services Committee, the Sigma Theta Tau International Nursing Home Society, and the Pennsylvania Association Directors of Nursing Administration Long-Term Care. Joanne, I will now turn the program over to you.
Thank you, Christine. Welcome to our first installment or first webinar in the Long-Term Care Emergency Preparedness Series. This is a 10-month series, and these webinars will be held the second Thursday of each month at 12:30 p.m. This webinar series was developed in response to the Long-Term Care Annual Survey that you filled out, as there were many requests for assistance with emergency preparedness on those surveys. I am going to ask all of you to complete a pre-series survey at the end of this presentation. This will help you ascertain your facility's level of preparedness and also provide me with information on issues facilities may be experiencing and opportunities for improvement. This helps to tailor education to meet your needs. There will also be tools introduced with each webinar to assist you, and as always, there is one-to-one support available through the infection prevention team here at the Patient Safety Authority. Long-term care facilities and their staff play a key role in emergency preparedness and response efforts for all types of events, including natural or man-made disasters, pandemic outbreaks, or terrorist attacks. The continuation of services is essential during an emergency or a disaster. With proper preparation, your facility can keep residents and staff as safe and ready as possible. So our objectives for today's presentation are on the screen. We're going to discuss the CMS 4 core elements of an emergency preparedness program, describe the steps to create an effective emergency preparedness program, list 3 types of natural disasters, and then review APIC's identified domains that describe the infection preventionist role in emergency preparedness. And this first webinar is more of an overview, and then each additional webinar will go more in depth in each of the topics. The National Preparedness Goal defines what it means for the whole community to be prepared for all types of disasters and emergencies. The goal is succinct. It is a secure and resilient nation with the capabilities required across the whole community to prevent, protect against, mitigate, respond to, and recover from threats and hazards that pose the greatest risks. And these risks can include events such as natural disasters, disease pandemics, chemical spills and other man-made hazards, terrorist attacks, or cyber attacks. So what is emergency preparedness? Well, it's the steps that are taken to stay safe before, during, and after an emergency or a disaster. FEMA, the Federal Emergency Management Agency, defines preparedness as a state of readiness to respond to a disaster, crisis, or any other type of emergency situation. But it is important to remember that emergency preparedness is not just a written plan that's once and done and then put in a binder and housed somewhere in the facility. It is not a plan, it is planning, meaning it is a continual process of reassessing and improving or upgrading that existing plan. The vital capability to respond quickly and appropriately to any emergency is built through the efforts of planning, training, and exercising. The U.S. Department of Homeland Security defines it as a preparedness cycle, which is seen on the right-hand side of the screen. It is a continuous cycle of planning, organizing, training, equipping, exercising, evaluating, and then taking corrective action in an effort to ensure effective coordination during an incident. So it is an ongoing process. It is never just a once and done item. So here are the different types of disasters. You have your man-made disasters, which could be an active shooter, which unfortunately I did experience at my previous job, or biohazards, epidemics, chemical emergencies, hazardous material emergencies, or cybersecurity, or the natural disasters such as earthquakes, pandemic, flooding, hurricanes, tornadoes, volcanoes, wildfires, and winter storms are also listed and can definitely cause a disaster if you have a severe snowstorm that you cannot get staff or supply into your facility. At that point in time, you're activating your disaster plan. CMS Final Rule 483.73 was published on September 8th of 2016 and became effective November 15th of 2017, that address the four core elements of emergency preparedness. CMS added emerging infectious diseases to that rule in February of 2019 as they determined it was critical for facilities to include planning for infectious disease as part of their emergency preparedness plan. And then you're all well aware of what happened in December of 2019 and January of 2020, which was when COVID hit. In response to the COVID-19 pandemic, CMS updated the rule and released additional guidance in March 26th of 2021. But the emergency preparedness rule outlines four core elements of any emergency preparedness program in long-term care, and that is risk assessment and planning, policy and procedures, communication plan, and testing and training. And we're going to go into each one of those in more detail. So your emergency preparedness plan. Facilities develop an emergency preparedness plan based on not only facility risk, but community risk. You need to evaluate both internal and potential external hazards. And this risk assessment is done using an all hazards approach. You're looking at hazards that are likely within your geographic area, care-related emergencies, equipment or power failures, interruption in communications, including cyber attacks, loss of all or a portion of your facility, loss of all or a portion of your supplies. But this risk assessment is done annually or with any changes in either service you may be providing or changes within your community. And one thing to think of is if you now develop and take on ventilator residents that you've never had before, at that point in time, you need to risk assess to make sure you will have everything required to maintain their care. This is an all hazard risk assessment, and this plan is reviewed. The risk assessment's done yearly, and the plan is reviewed and updated at least yearly. One thing to think about when you're doing your risk assessment is what type of resident population do you have, and have you addressed services to provide for continuity of your operations or any succession plans if you would have to evacuate. The other core element of policies and procedures, you need to develop emergency preparedness policies and procedures based on that risk assessment, also on your communication plan and your emergency plan. You also need to address subsistence needs, resident tracking, a process for evacuation or shelter in place, protection of medical information and documentation, and arrangements with other community providers in the event of an evacuation or a transfer. One thing to remember with all of your policies and procedures, make sure they comply with state and federal laws. Make sure within your policies and procedures for emergency planning, you have a system well documented to contact staff and significant other people, such as residents' families, their physicians, and then your local emergency management people, such as ambulance providers, if you would need them for an evacuation, the fire company, or your local emergency management agency. But your policies and procedures need to make sure that you have a well-coordinated plan across your facility, but then reaching outside your facility to healthcare providers and state and local public health departments and emergency management agencies. The communication plan. Your emergency preparedness program needs a comprehensive communications plan. It needs to comply with local, state, and federal laws, but it must include contact information for your relevant partners. Like I said, your staff, your providers, your LIPs, residents' families. This communication plan, should detail the processes for the exchange of resident information, bearing in mind HIPAA practices, and also identify primary and alternate means of communication if the one system would go down. If you would lose cell service, or we would lose telephone service, how else would you communicate with the outside world? Those are all things to think about within your communication plan. And then training and testing. You risk assess, you write your plan, then you need to educate and provide training. Initial and annual education is required along with training. And then you need to conduct exercises to evaluate your plan. For any plan to be useful, it needs to be tested periodically to determine if it works and if weaknesses appear once it's tested. Unless your emergency preparedness plan is tested routinely, it is not truly a functional piece of work, which is the goal of having a plan. Finding out during a crisis that your plan has real weaknesses is not the time to face that kind of risk. For this reason, there needs to be an exercise plan that includes both an evaluation piece and improvement planning. The Centers for Medicare and Medicaid Services, CMS, requirements state that long-term care facilities must offer training on emergency procedures at least once annually and must complete at least 2 exercises annually. One full-scale exercise that is either community or facility-based, and one other exercise of the facility's choice. So where do you start? The facility's emergency preparedness plan is your guidebook. It is your guide to navigate an emergency or natural disaster. Facilities need to have an emergency action plan in place that's capable of providing for the safety and protections of residents, staff, and visitors. And as I've said before, this plan must be reviewed, tested, and updated annually. So here are the steps on the screen to creating an effective emergency preparedness program. You need to assemble a team. A multidisciplinary team is always needed because everyone brings different strengths and ideas to the table. Once that team is assembled, then the all hazards risk assessment is performed. looking at both internal and external potential risks. After the risk assessment is done, then the team evaluates it and establishes performance objectives. These performance objectives need to be quantifiable and tangible milestones to assist in staying on track as you develop the program. Once your performance objectives are written, that is the time you then create your written plan. The plan is based on the all hazards risk assessment and includes strategies for addressing the events identified by that assessment. It also includes the communication plan and addresses resident population and continuity of operations. The plan also includes a process for collaboration with local, state, and federal agencies. After the plan is written, then education is provided. Initial and annual education and then training in emergency preparedness is required for all staff. Then we conduct exercises. This is how you test the effectiveness of your plan. A facility conducts exercises to test the plan at least twice a year, including unannounced staff drills. So, what is the role of the infection preventionist? Infectious disease outbreaks and transmissions can occur during or following any type of disaster. The greatest risk of transmission occurs during a disaster involving an infectious disease or agent, such as bioterrorism attack, outbreak of an emergent infectious disease, or what you are all living now in the COVID pandemic. Natural disasters also can have a significant health impact if infection prevention strategies are not implemented. Natural disasters, such as a hurricane or flood, may require evacuation and opening of shelters to house your residents. This can result in infectious disease outbreaks due to overcrowding, lack of hand hygiene capability, or lack of infection prevention procedures in the shelter. APIC, the Association of Professionals in Infection Control and Epidemiology, has an emergency preparedness committee that has identified these 9 domains that describe the role of the infection preventionist in emergency preparedness: knowledge of disasters and emergency management, assessing readiness and emergency management plans, infection prevention coverage, participation in disaster response and recovery, healthcare policy development, surveillance for infection, resident management, physical plant issues, and the infection preventionist as an educator. It is very important that infection preventionists are involved in the development of an emergency management program so that they are prepared to assist during mass casualty incident response and recovery. That was just a brief, in a nutshell, overview of your emergency preparedness plan and the CMS requirements. As was noted at the beginning of this webinar, each one of these webinars are going to introduce some tools to assist you in your facility with emergency preparedness. So here's the tools we're going to look at today: the Pennsylvania Healthcare Coalition's map, Pennsylvania Safety Authority resource document for emergency preparedness, and your Pennsylvania Patient Safety Authority infection prevention team. The Pennsylvania Department of Health defines a healthcare coalition as a formal collaboration among healthcare organizations and public and private partners that is organized to prepare for, respond to, and recover from an emergency, mass casualty, or catastrophic event. I would think most of you are well aware of your regional emergency or regional healthcare coalition and the contact information for them, as these are the people who have been holding the weekly calls on COVID. This is their map of the 6 regional healthcare coalitions by county. I'm in the Keystone Healthcare Coalition, which is the black one in the center of the state. When you find where your county is and what region you're in, the box associated with that region will list who your contact is and have their contact information. And everyone should keep this somewhere readily available. These are the people you contact when you are having an emergency issue for assistance. The second tool is we developed an emergency preparedness resource document. This is a toolkit. This resource guide contains links to planning resources for emergency preparedness. And these are tools and links that were done by the experts. You will find tools in there and planning resources from Centers for Disease Control, from APIC, from CMS, Health and Human Services, and FEMA. And I would strongly encourage you to take a look at this resource guide and the tools that are linked in there, as they may be of benefit within your facility. Take a look at them and have your team look at your emergency preparedness plan to see if there are some tools that you don't have or that may be easier for you to use than what you currently have in your plan. And then the third tool today is your infection prevention team. These are the 3 infection preventionists at the Patient Safety Authority. Between the 3 of us, we have more than 35 years experience in infection prevention, so we are your resources. We are your resident experts. I have listed our contact information below each of our pictures, and I put the pictures on there so you could put a face to the voice. But anytime you have infection control questions or issues, please reach out to one of us for some assistance. We are here as a resource for you. Here is the list of the webinars for the series. The next webinar will be held on March 10th at 12:30 p.m. and it's titled Who's at the Table? This webinar is going to discuss in depth incident command and the roles of the various team members of the incident command team. And I know that's something that I have gotten questions on in the past, and I know Christine has gotten questions on in the past. So please join us for that webinar as we talk more about incident command and what the role of each team member is. Here are the links I was telling you about. The first link is a long-term care emergency preparedness survey that I developed. I would like all of you to please complete this brief survey for 2 reasons. The survey, as I said in the beginning, will help you see your facility's level of preparedness, but then it also provides me with information on areas of opportunity or issues that facilities may be dealing with. So as this webinar series continues, we can address those problem areas. So please click on that link and take that survey. And then at the end of this webinar series in December, I'm going to ask people to do an evaluation and to also take the same survey again so that you can see if you've improved, but it also helps me see the effectiveness of the education that was provided. The second link on the screen is the link for the webinar series flyer with the registration so that you can register for the series. The third link is that resource document for emergency preparedness. That's a document that was developed that has the links to tools in it for your use. And then the fourth link is the Pennsylvania Healthcare Coalition map. And if you do not have a copy of it, you do want to save a copy of that map so that you have ready access to who your contact is and their contact information. So what I want you to think about through this entire webinar series is, are you ready? Is your facility ready to address any emergencies that may arise? So Christine, I'm going to turn this back over to you.
So, Joanne, we do have a question in the chat box. If they have already completed the survey, do they need to complete it again?
No, they do not. I just would like everyone to complete it at the beginning of the webinar series to evaluate themselves and also to provide me with information.
Okay. And then for those of you that may not be familiar with WebEx, if you do have a question, you can type them in the Q&A box found at the bottom of the screen. You just have to click on those three dots, then click Q&A to open a Q&A panel and direct your questions to all panelists, and we will try to answer as many as we can. There's another question. It says the survey is not showing on the PowerPoint on the links that you just discussed. And so we can address that here momentarily. We do have another question. We have been doing an infection prevention risk assessment yearly. Can we use that assessment for emergency preparedness instead of a second assessment?
No, you need to do both assessments. The infection prevention risk assessment does address some of the same items that are seen on an all hazard risk assessment, but it does not cover all hazards. It does not look at the potential risks you may face from a chemical spill, for example, or an active shooter or a cybersecurity breach. So you need to do both risk assessments, and they must both be done annually.
Thank you. Okay, the next question, why is it necessary for the IP to be an active member of the emergency preparedness team, as most of the potential disasters you have listed are not infections?
It's important for the infection preventionists to be actively involved because even though the disaster may not be an infection, the risk of developing communicable disease or infection is very high. Looking at major disasters such as hurricanes or flooding, I know I had said about if you've had to move to a shelter, there were infection prevention risks. But if you would have flooding within your facility and shut down that wing, you would still have infection prevention risks because of the potential for mold development, aspergillus, Legionella, those types of infection prevention risks. Plus, IPs are very experienced in not only surveillance, but policy development, evaluation of the environment, that sort of thing. So an IP brings a tremendous amount of knowledge to the table and needs to be an active member of that team.
Thank you, Joanne. This concludes our webinar. Thank you.